Good morning, Madison Park. Hope all is well with all students and staff. And this is our first live remote assembly program via satellite. One of the things we really have to impress upon folks is that we are in an uncharted waters here with this situation with the coronavirus, and it is having a detrimental effect on life as we know it. And one of the key components is having the effect on the education of you young people. But one of the things we really want you to understand is the seriousness of the spread of the coronavirus. And you'll hear from our own, Ms. Opal Hines Fisher, to give you some of the particulars about not only the disease, but what we should be doing to safeguard ourselves. We are going to be out of school till April 27th. That is a long stretch of time to be separated from education. And one of the things that we have to do as the adults and the educators in this building is keep you connected to education, monitoring what you're doing, but most importantly, making sure that we do something to have you staying focused on education and connected. And Ms. Dickens, our principal, will be sharing that information with you. But again, as I stated earlier, we are in uncharted waters. This hasn't happened since 1918. And contrary to popular belief, Mr. McCaskill and Mr. Solis were not born at that time. So one of the things we are doing is everything is speeding up. People don't know what to do, and it's understandable. And I think we all must have patience, including the adults, not only here at school, but even outside of school in your homes. You're going to be home for 6 weeks, and parents are going to be under pressure. Students, I'm hoping that you understand the pressures that your parents are going to be going through, especially if you have multiple siblings. It is your responsibility to help out and be that helping hand at home. Also maintaining a sense of who you are as well, maintaining your mental sanity, but most importantly, understanding your responsibility as it goes to school and at home, and most importantly to you as an individual. So with that, I'm going to have Ms. Opal Hines Fisher come out and speak about the coronavirus. Ms. Hines Fisher?
Hi, we're at Madison Park Technical Vocational High School, and I'm here with Nurse Hines Fisher. And she's going to give you an update on exactly what is COVID-19.
The coronavirus, as it's commonly called, it is often linked to the same symptoms as the flu, and it's sometimes coronavirus can cause very serious illnesses. And as we know, it was started in China and now has unfortunately spread across the country.
How does COVID-19 spread?
It's spread between people, usually in social interactions. It's caused from droplet precautions that unfortunately is remaining on surfaces for, at this point in time, unknown periods of time.
What are the symptoms of COVID-19?
Well, similar to the flu, it's respiratory symptoms that include mild as well as severe. It may be the fever, it may be a nagging cough, as well as shortness of breath. The CDC believes that the symptoms of COVID-19 may start between 2 to 14 days after exposure, after being infected, and anyone who thinks they may have been exposed to COVID-19 should contact their healthcare provider right away.
How can kids protect themselves and/or young people and their families from COVID-19?
Well, there are a number of different ways that it's being suggested by the Center for Disease Control. The basic one is really hand washing. And if everyone remembers the basic singing the birthday song several times and washing your hands with warm, soapy water.
Can you demonstrate that?
Oh, happy birthday. I really can't sing, but happy birthday to you. Don't forget your thumbs, underneath your fingernails, the backs of your hands, to 20 seconds to warm water, and being careful as you turn off the tap to use a piece of paper towel, or if you're at home, use toilet paper and turn off the tap.
So let's come back to that, because I think that's really important when you talk about sanitation. So first we should wash our hands for about, you said 20 seconds?
About 20 seconds, yes.
And then you said make sure that we completely wash inside our hands and our thumbs.
Yes.
And then after washing our hands, we take a paper towel?
Yes, paper towel or toilet paper if you're at home, and make sure you turn off the faucet with the paper towel and dispose of the toilet tissue or the paper towels in either in the bathroom or someplace in the trash receptacle.
So you're saying when I'm through washing my hands, don't just touch the faucet again.
Exactly.
Make sure I use the tissue to touch the faucet because the faucet's semi-contaminated.
Absolutely, absolutely. So for those of you that have hand sanitizer, that's also recommended to use an alcohol-based hand sanitizer, and make sure, once again, that when you're touching surfaces, to be careful and mindful as you're touching it. In addition to that, we're suggesting to families to please disinfect areas that are commonly touched, bathroom doorknobs, doorknobs in your home, refrigerator doors, just being mindful to disinfect as frequently as possible.
So you're saying constantly wash my hands to make sure that they're clean, disinfect everything around me. This is really important information, you guys. So we want to make sure that you really get this information. So basically, we should be constantly cleaning.
Absolutely, absolutely being mindful.
Okay,
Yes.
now there's this thing about social distancing, and it's really important. I apologize for saying it that way, but it's really important. So, Nurse Hines-Fisher, could you tell us a little bit more about it? Because this is really, young kids are going to be out of school, so they're going to be hanging around other kids. How can they protect themselves? Because this is really important.
The Center for Disease Control is really recommending that we remain at least 6 feet from each other because, of course, the impact of droplet precautions. Because everyone knows as you're speaking, droplets are coming out. So what they're suggesting is to really avoid group gatherings, sleepovers, play dates, concerts, going to the theater, athletic events, most of which have already canceled, crowded retail stores. For example, if you need something at the supermarket, try to go at a time when it's not so crowded, and most certainly the mall. Working out at the gym is also recommended that we avoid, and of course, discourage people from visiting your home. And at this point in time, of course, the CDC has recommended non-essential workers to not come into your home unless they have to come in, and avoiding mass transit if you can.
Now, what are some safe things that I can do? I'm a child, I'm at home. It has to be a few things that I can do so I don't really upset my parents all the time. It's going to be tough being home all day in the same space with a couple other family members.
Yeah, so they're saying in terms of using caution, you can visit a local restaurant to pick up food. As you know, we can't actually dine into a restaurant. Visiting a grocery store, go in, get what you need, and leave as soon as possible. You can still get takeout if necessary. Pick up your medications is definitely advisable. You can play tennis in the park. You can visit the library, but I'm not sure libraries are still open. Church services and traveling, they're saying to use caution if you're doing that. But it is safe to go outside for a walk. We're saying encourage exercise if you can, just not in a large group. You can play in the playground, just be mindful of what you're touching. How about cleaning out your closet, reading a good book, and making sure to do your homework for Madison Park, cook a meal, play games, have fun, video chats with each other. Independent play is wonderful at this point. Just be mindful in terms of large gatherings.
Okay, Madison Park students, this message was brought to you by Nurse Hines-Fisher, right here in our building, someone that you can trust.
Good morning, Madison Park. Thank you all for being here today. I just want to reiterate a few of the things that have already been said to you. Our priority over the next 7 weeks is to make sure that we continue to monitor your well-being and to keep you safe and supported through what will be a difficult time. In terms of well-being, today you are in home base. That will be the center of our communication with you over the next 7 weeks. Every other day, someone will reach out to you to see if you're healthy, to see if there's anything you need in terms of food or medicine or access to services that we can support you with. Please respond to these emails or texts or phone calls so that we know that all of our students are safe during this time. The second thing is we want to make sure that you have access to your learning. Learning will be different virtually, but we want to make sure that you continue to learn and be supported over this time period. So it is important today that you are able to log into your school email, that you are able to access Google Classroom, you have a Chromebook if you don't already have one, and that we tell you about the resources for internet access at home. So please ask your teachers or any administrator for support in these areas if you have not taken care of these tasks. If you need assistance logging into Google Classroom, here is a link to assist you. And if you need to know where food will be available during this closure period, please look at this link. It will be updated by the City of Boston with additional resources as we move through this closure. Thank you so much, and have a great day.
So folks, that's what we've got. We're going to be separated from each other for 6 to 7 weeks, but you've been told about how the expectations of academics, vocational, how to get additional food for not only you and your families, and also for your well-being from a health perspective. Please, please, please feel free to email any of the administration, your teachers, your counselors, call the school. We will be here at school. Everything that we're doing is geared for you. Over the next 6 to 7 weeks, it's going to be vital that we all work as a team. Teachers, administrators, itinerant staff, students, parents, central office staff at Boston Public Schools, and the City of Boston. We all have to come together as one so we cannot have such a disruption cause any further damage to the well-being and education of our students. So with that, thank you for your time. And again, I can't reiterate enough, contact us if you have anything. Have a great day.